name is Brandon Smith. I'm the chair of the Health, Environment, and Social Services Committee of Community Board 2. Welcome to our November meeting. It's going to be a great meeting, and I'm even more delighted to see that probably one of the first times in human history we actually have quorum to begin the meeting, which is great. For the purpose of this meeting, and by means of public disclosure, I must inform you that this meeting is being recorded for the purpose of transparency and for permanent public access on the CB2 YouTube archive. All attendees, please keep your microphones muted when you are not speaking. District staff will actively assist in maintaining this protocol. It is the practice of Brooklyn Community Board 2 to conduct remote meetings with all committee members' cameras on for full transparency. We encourage all attendees to also leave their cameras on, particularly if you are given the floor to speak. To maintain appropriate discussion and voting process, I will make it known when and which topics are open for comment by committee members, board members at large, and the general public. If you wish to speak, please use the Webex feature in the participants panel to digitally raise your hand or lower it, and I will call on you in order. If you have questions that fall outside of public comment time, please type your questions in the chat panel, and we will address them if relevant to the matter and as time permits. If any attendee experiences technical difficulties with the Webex software or features during the meeting, please consult help.webex.com. After the meeting, please reach out to the district office at bk02.cb.nyc.gov. It is our desire to provide access for all of our neighbors, regardless of physical ability or limitation. If you require any accommodation or assistance for full participation, please contact the district staff office 72 hours before any public meeting. We will now begin the committee roll call, and I'll ask each member of the committee to introduce themselves. Jessica, do you want to start?
Sure. Hi, I'm Jessica Thurston. I'm the secretary.
Okay. Barry? Barry Newmark is a member of our committee and public member, and we're happy to have him. Nicole, do you want to introduce yourself?
Good evening, everyone. I am a committee member.
Okay, great. Victor, do you want to introduce yourself? I guess we'll wait for Victor for a second. Alejandro?
Hey guys, it's Victor. I'm here. Committee
Okay.
member.
Hi, Victor. Alejandro, do you want to introduce yourself?
Hi, Alejandro Varela, public member.
Great. I think I got everybody who's a member of the committee. Welcome everybody who's a member of the public. Nice to see you again, Emily. Thank you for coming back. Good to see you. Okay, let's get into our agenda for the evening. Well, before we get into that, I'd like to ask for a motion for tonight's agenda. We got a motion from Barry. We have a second?
I'll second.
Second from Jessica. Okay. Victor, are you in favor of tonight's agenda?
Yes, I am.
Okay, great. Can everybody else just raise their hand so I can see consensus?
Excuse me, Brandon.
Yes?
I sent you an email with some further amendments to the agenda. Did you receive that?
I did, yes.
24 Green and 275 Park will not appear.
Okay. All right. Can I just get a show of hands once again from the committee members only regarding the agenda, just with that consideration in mind? Excellent. I believe that that is consistent.
Yes.
Thank you, Victor. Great. All right. Next on the evening, we are particularly honored to be joined by a couple of speakers tonight. We have Dr. Mary Foote, Senior Health Security Specialist from the New York City Department of Health and Mental Hygiene. We also have Anna Schatz from the Office of External Affairs. I believe I saw Dr. Foote in the participant list. Do we have, and I see Ms. Schatz also. Dr. Foote, do you want to introduce yourself?
Hi, everyone. Thank you for the invitation to speak with you tonight. My name is Dr. Mary Foote. I'm an infectious disease specialist. I work in the Office of Emergency Preparedness and Response in my sort of day job, non-response role. And in the COVID-19 response, I am one of the directors for healthcare system preparedness and response, and also do a lot of healthcare system planning and strategies. So thanks for having me.
Okay, that's great. And Ms. Schatz, do we have you on the line also?
Yes, hello. Hi, everyone. Thank you so much for your invitation, for having me here. Dr. Mary Foote is going to be presenting, but I'm here. I'm representing the Community Affairs and Office of External Affairs at the Department of Health. So anything that we won't be able to answer tonight, I am happy to follow up with and get back to you after this meeting. And anything that does come up, please feel free to reach out to me with any questions, and we'll do our best to get everything back to you, as much information as we have. Thank you so much.
That's great. Thank you very much. Okay, well, Dr. Foote, feel free to begin with your presentation. We're really honored to have you. Thank you for coming. And for everyone else's benefit, we're going to be talking about COVID-19 and the response and the future of our approach to this. So I think this is really timely, and we have some very experienced and credentialed guests with us. So thank you, and please commence with your presentation.
Okay, great. So full disclosure, my remarks are going to be pretty limited because I wanted to just leave a lot of time for open discussion and questions. So we'll just give you sort of a quick rundown of current situation, and both globally and here in New York, and go down to Brooklyn level. So globally, we are at more than 47 million reported cases throughout the world, and these are confirmed cases. New York State has had almost 250,000 reported cases outside of New York City, and in New York City, we have had actually more than that at 265 reported cases at this point. We are at, our total death count right now is at about a little over 19,000 confirmed deaths, and another 4,600 probable deaths. And those are deaths that are reported by our OCME after death, if COVID is listed as a cause of death. So in Brooklyn specifically, drilling down, you've had a total of 74,000 confirmed cases, and about 23% of which have been hospitalized throughout the response. And in Brooklyn, there have been about 5,700 confirmed deaths and 1,600 probable deaths. And, just generally from the global perspective, we are seeing a really, I'm sure this is not a big surprise to most of you, but Europe is really kind of the big hot spot at the moment. And there have been, just over the last couple of days, some much more severe measures, social distancing measures and lockdown measures being taken in Italy, Spain, Portugal, UK, and other countries. So just in terms of trajectory of their outbreak, they are, this is sort of a similar scenario to what we were seeing in March, where they seem to be a few weeks ahead of us in terms of their trajectory, and we are kind of having acceleration that is really mirroring what they're seeing, what they were seeing a couple weeks ago. So we're obviously very watching things very closely. And New York City wise, in New York in general, we've been doing quite well, all things considered, especially compared to the rest of the country. Just over the last few weeks, we have, started out having more cases in particular pockets, particularly in Brooklyn and Queens. And that is what has prompted this new cluster response that has led to some localized restrictions. And that is an initiative that is really being led by the governor's office at the state level, but it is impacting largely communities within New York City. And I'll go over kind of some further information for that in just a bit. So we were initially a few weeks ago seeing really kind of pretty discrete areas and communities, specific communities that were really having a higher level of transmission. But now we are seeing a much more broad dispersion of upticks in cases. So we now have pockets of increasing infections pretty much in all 5 boroughs. So this is something that we are certainly concerned about and are watching very closely, and may have to take more further measures to try and control if things continue to increase. But we are hoping that the measures that we're taking right now will be effective, and we'll see some impact for that. But of course that's something that we're watching very closely. We are seeing some increases in hospitalizations, and that's we've seen it in Manhattan as well as Queens and Brooklyn, but we're also starting to see now Staten Island and Bronx as well having an increasing number of COVID patients in the hospitals. Nothing that has overwhelmed or stretched the system so far. We're in very close communication with hospitals pretty much every day. And as of now, there have been some very early response in the hospitals in terms of creating special codes. But so far, no one has had to implement aggressive surge plannings where they've had to really aggressively increase bed capacity. So they've been able to absorb the amount of patients that they're seeing pretty well. So as of now, we're kind of comfortable with the hospital system's preparedness and ability to handle what we're seeing. And they're certainly much, much, much better off in terms of preparedness and planning and supplies wise than they were back in March. So I think the only other interesting update I did want to highlight in terms of the city and state is that the governor's office over the last couple of days, over the weekend, has changed their, let's say, I guess it's an executive order, but their travel advisory and restrictions. So instead of having, a list of specific states that were under travel advisory, it's now been changed to basically, and if you're traveling anywhere in the country and in any state that is not contiguous with New York. So the exempt states include, I believe, New Jersey, Connecticut, Massachusetts, and Vermont. And if you're traveling to any other state, then you can either just do as what we have been doing and have you quarantine for 14 days when you arrive home, or there's now the option to, I guess I call it the opt-out option, which would be you would have to be tested within the 3 days before returning, tested for COVID within 3 days before returning back to New York City. And then you would be asked to, assuming that was a negative test before you left, then you would be asked to quarantine at home for 3 days. And then on the 4th day, you would get tested. And if that test was negative, then you could end your quarantine. And if, of course, obviously, if you do test positive, then you would then go into be enrolled in our test and trace program and be asked to isolate until you were no longer infectious. So I think those are the big highlights that I wanted to touch on, just to give you a snapshot of where we are. And I would be very happy to open this up for discussion and questions.
Thank you very much. That's really insightful to hear, and good to know about some of these details about what's going on presently, particularly. I want to have the committee ask some questions. I think just like first, I wanted to ask you to touch on some of the things that occurred back in March in terms of the closures and the announcements, and when we all found out about this at the very beginning. I think, part of our committee's approach, we're located here in downtown Brooklyn, and also Fort Greene and Clinton Hill and Vinegar Hill and Borum Hill and Dumbo and some of these neighborhoods here. And in our meetings, we have different health providers will come before us at times. And I think we were really struck when one of our community health centers came to us early in the year for one of our first video meetings, and said that they were just completely out of supplies, and he didn't feel like they had the guidance to really talk to patients about the risks that were coming up in terms of what to do when you presented symptoms that might have been similar to COVID-19. So I just wanted to ask you all to touch upon what happened at the beginning, whether you feel like the rollout and the closures of everything was effective and efficient from looking back in retrospect, and if there's any light that could be shed on why it was that because I doubt that the healthcare provider we spoke to was really unique in this regard. Why was it that healthcare providers didn't have these supplies? And then just finally, from a looking back perspective, any lessons learned, and anything at all, and it's fine if there's not, anything specific to the areas that I described of downtown Brooklyn, Brooklyn Heights, Fort Greene, Clinton Hill, we're also really concerned as a committee with the NYCHA communities within our district, and it's a point that we've been wanting to make with the Department of Health for quite some time, because the community health profile that was issued in 2018 referred to our district as quote unquote Brooklyn Heights and Fort Greene, and yet we have other communities that are within this district, some of which are experiencing the pandemic much stronger and forceful than others. And, we kind of felt like our health profile had landed us in a position where, it sort of trended to be more positive than it really was for some of those more impacted areas. So, thinking about all of that, I know there's a lot in there, but could you touch upon the stuff from earlier in the year?
Yeah, I would say we could probably have an hour conversation on any one of those topics. I'll do my best to do justice to your questions, but I think they're all very fair concerns. I can go back to the beginning and give myself a little PTSD while I'm doing it. But I think really for us in New York, obviously, we were all living it, but our biggest challenge, and I think what handicapped us more than anything else, was the lack of testing, and just the fact that we had probably could have gotten testing on board a lot earlier if things had been done differently on the federal level. Because, New York City, New York State Lab and other like Northwell and some of the other commercial laboratories actually got testing capacity, could have been doing testing much sooner than they were. And so that really did just leave us flying blind. I know that's kind of a cliche, but it really hobbled us. So, we at the health department, we were watching the numbers and watching our surveillance information from the emergency rooms and seeing, people coming in with flu-like illness that, we knew were not being diagnosed with flu, that was indicating that we were having COVID circulating quite early, quite early in March and late February for sure. So, I think that in itself is we are in a very, very different place now, where we probably have some of the most robust testing capabilities in the country, I would say. So that's good, and that's an advantage, but I do think that we're still we're putting in a lot of effort to making sure that the right communities are being tested, meaning, we still see a heavy concentration of testing being done in the wealthier parts of Manhattan, where of course we'd like to see testing being utilized a lot more, in the outer boroughs, particularly in the most heavily impacted areas, during the first wave. So it's certainly not from lack of trying. H&H Health and Hospitals and the Test and Trace Corps have put in a tremendous amount of resources and effort to get testing sites set up, really throughout the outer boroughs. But it's a matter of trying to, really increase uptake, and I think community awareness of that. So that's been an ongoing challenge, but we're getting there. We hope, and certainly more every day we're improving our capacity to do testing. So I know testing question and testing supply and access was high on your list of questions. So, and I think another challenge and certainly lesson learned, and very complicated in terms of the factors that went into those decisions about closing and shutting things down earlier. I mean, I think we would all say that we, should have probably shut things down sooner, particularly schools. But that was such a complex decision in terms of, how does it impact the healthcare system and essential services when you shut down schools and people have to stay home with their children, and you have caregiving duties and the health and well-being of the children, making sure that they're able to access food and healthcare and other essential services. So, and of course, it was also not just a decision on the city level. It was very much a lot of decisions were heavily impacted by decisions coming down from the state. So, I would love to say that we've learned a lot of lessons from that. So I'll be optimistic on that. And so I think those were some of the big things that I can really speak to. And in terms of impact on healthcare, and I also am a healthcare provider. I work at Calvin Lord, who just opened a site in downtown Brooklyn, which is very exciting. The healthcare impact was really interesting in that we all expected the surge in the hospitals. That obviously was not a surprise, but we were expecting a surge on all healthcare services, including in the outpatient sector, and that really didn't happen. So, there was obviously the very strong messaging about if you're sick, stay home, which people actually really did adhere to, and there was a lot of fear of just seeking healthcare in general. If you weren't coming in for COVID, obviously there was a lot of fear and concern that you would end up getting COVID if you went to a healthcare facility. And so we saw just people's interest or ability to access outpatient healthcare just bottom out and drop precipitously. The other challenge with the outpatient was certainly the access to PPE, personal protective equipment, and that is absolutely like a full day we could spend talking about PPE, and that was a big part of my work during the surge. But we did have a stockpile from the city, obviously global supply chains for personal protective equipment, masks, especially, and respirators. I mean, even back in January, we were already seeing runs on supplies, starting to see strain on the supply chain. And that was, before we ever saw a case in the US. Part of the challenge was a lot of personal protective equipment, especially respirators and masks, are manufactured in China, particularly in the Hubei province. So it was just sort of, those compounding factors, and everybody in the globe was really going to the same suppliers and same equipment manufacturers and factories, a lot of which were shut down. So, I mean, part of the issue was just there just wasn't any to get. And then the stockpiles that we did have, on the city level, it was, I would say, probably some of the hardest discussions and decisions that I've ever had professionally was deciding who had to be prioritized to get personal protective equipment. And we really, at a certain point had to really prioritize the health and safety of the hospital workers because that's where the patients were going. And, if they needed to seek care, they could either access telemedicine, for non-urgent issues, or they would go to the hospital for urgent issues. And that's, so these real, we had to prioritize the health and safety, the real emergent services in that case. And of course, nursing homes were a high priority, and other specific groups that were prioritized. So definitely hospitals, definitely EMS and first responders, and the nursing home sectors were really, and the alternate care sites. So unfortunately, that left a lot of the outpatient practices in a bind, and even if they could find supplies, it was wildly expensive for them to access. So that was a big challenge. So they very understandably, a lot of people just were not comfortable, being able to see patients. So there was a big shift. Fortunately, in one way, it's been a big win from this is that we've seen efforts to move to telemedicine and remote care, that have been moving at the glacial pace for a decade, have all of a sudden been accelerated. So, now most practices are set up to provide telehealth, and CMS has created better reimbursement structures to actually sustain the provision of healthcare remotely. But in the beginning, that wasn't there. So a lot of people, literally overnight had to try and build systems to provide care remotely to patients that were often very complex, with a lot of social complexities as well. So that was a huge challenge, and they were putting in a lot of time and effort and expense to this, and getting very little reimbursement back for telephone visits and things like that. So that took a while to really move the needle, and get them better reimbursement so they could actually financially survive, and maintain their practice. So I think I touched on a lot of what you asked about, sort of the beginning and the impact on the healthcare. Were there other specific
you
things?
did an amazing job of touching upon all these different things. The last part was,
I can really
was
talk,
there,
just to
was there
warn you.
anything specific to downtown Brooklyn or to our surrounding communities down here?
Yeah.
Fort Greene, Clinton Hill, what have you. And it's okay if there's not. I understand if the data doesn't go that granular.
Yeah, so I'm in the chat page. I'm just going to share our data page. So on the DOH site, we do have some maps where you can kind of see what the trends have been by zip code. So I would say that this area of Brooklyn has been, and I am also in this area of Brooklyn, so this is my home base. I would say if you just look at the raw numbers, it was kind of in a moderate impact zone. But of course, when you really get granular and you look at the NYCHA residents and the communities of color, and especially when you look at the, stratified by income, multifamily housing, people that are living in more crowded, apartments, the frontline workers, that did not discriminate by neighborhood. Those were people that were impacted throughout Brooklyn and Queens, and the Bronx. So, it certainly had a big impact. And I know the Brooklyn Hospital Center, I'm not sure what other hospitals are within your zone, but certainly were heavily impacted. And, we worked very closely with them throughout the response. So,
Oh, thank you for
that's
that.
helpful. And I will say,
No,
if you take a look at this
I
data
think
site,
that's pretty helpful.
yeah, so this data site, we're actually going to be updating it with a lot better, more granular data on the neighborhood level. So look for that hopefully early next week.
Okay.
Yeah.
Questions from members of the committee?
I've rendered you speechless or put you to sleep.
Mr. Varela?
Hi, thank you, Dr. Foote, for your presentation. Apologies in
Sure.
advance for the background noise. My kids are about 10 feet away and I can't get them to stay quiet. I'm curious as to two questions. One is to what do you attribute the low testing rates in the poor communities that you mentioned earlier as opposed to the wealthier communities or areas in New York City? And what plans do you have to overcome those barriers? So that's my number one. Number two is, and really the reason why I was very interested in this presentation is to talk about the next pandemic, the next epidemic. What sort of communication strategies, or what have we learned, and how will we disseminate that? I feel like a lot of what was happening, and again, as we were all learning sort of as we went, that I was curious about, as everything has been unfolding, I wanted to see more information at bus stops. I wanted to know what the long-term plan was, and how we were going to roll things out, and to what extent we should do this, that, or the other. And I wonder, you know, as it concerns this, as it concerns natural disasters, I just wish we had a better sense of what the government's plan is, and how we are going to be involved in what we're going to do. And I wonder if those conversations are happening, what you already know. And then just one minor comment I wanted to touch on. I still feel, and I think you hinted at this because there's so many layers of government here involved in the process, that it felt to me as if the social determinants of health were the sort of the least considered in how to keep people at home. I kept waiting for some sort of omniscient voice to say, everyone, right now, with the limited information we have, we think this thing lasts for 2 weeks, which was the prevailing wisdom at the beginning. For 2 weeks, it was on surfaces. For 2 weeks, it was in the air. For 2 weeks. And I thought, why can't we do everything in our power to shut things down for just 2 weeks, as opposed to the 9 months we're going into now? And I know that's sort of near impossible, because so much of this public health stuff is politicized and is determined by the economy, really, right? If the economy wasn't an issue, we'd all be at home. And so anyway, so I wonder if you can talk about those things a little. I know that's a lot, or whatever you can touch on. Thank you, by the way.
Sure. And Anna, you can, my colleague Anna, hopefully can feel free to chime in about the testing, the low uptake of testing. You know, I mean, I think it's multifold. Obviously, like everything else, you know, it's complex, and there's no black or white answer. In terms of testing uptake, you know, one is just in general, access to care in the outer boroughs is not as good. You know, we have healthcare deserts, certainly, especially in, you know, communities that probably need it most. So that is definitely an issue. There's certainly been financial concerns, you know, so not only do we have people that, you know, at baseline before the pandemic had issues with healthcare coverage and being able to afford care. You know, that was compounded obviously by a huge amount of people losing their jobs, losing healthcare coverage, et cetera. So that we are still certainly feeling residual effects from that, and people are just worried about, you know, not being able to afford care, and so just aren't necessarily going in. You know, I think the other issue is, you know, I mean, you know, I will say it, there's a huge mistrust of, and understandable mistrust of, government and the system, and, you know, a lot of the testing sites that are being set up, you know, and I've heard this feedback from, you know, community partners, that there's hesitancy for people to go to a government-run testing site, and especially with the testing and trace program, I think that does kind of spark some concern and mistrust in some people. You know, I'm being registered in the system. You're asking like every detail about my life, who I've been with. And I think that's been a huge challenge for the whole contact tracing operation in general, but testing is very much attached to that. And in fact, we've actually heard, you know, we've certainly heard reports of underground testing operations where people are getting tested, but it's not part of the system that is reporting into our city data. So, you know, I mean, there's obviously a lot of things at play. And maybe Anna can talk a little bit about, you know, what the efforts have been, but, Obviously there's been a huge on the ground, like real feet on the ground effort to do local engagement, community engagement, especially in these kind of cluster areas, these cluster zip codes, and we've sort of we have a list of high priority zip codes based on, the social determinants, the highest risk areas based on social determinants, and how profoundly they were impacted by COVID. So these are areas where we have been doing a lot of ground game, putting in a lot of resources. We've been making sure that providers there have access to information, PPE, and the equipment that they need. They're being supported to do more testing, at the community provider level. So these are all things that we're, realizing, needed to be stepped up and better supported. We're engaging a lot more with, I think we certainly can always do better with engaging community-based organizations and our partners. And so I think, there's been a lot of effort to do that, really engage better with community-based organizations and let them, those that work and live in the community, really drive the messaging and outreach with our support, hopefully from behind. So those are kind of the things that I can think of, to answer your first question. What are we doing to prepare for the future? That's what I've been doing for the last 5 years after Ebola. So this is actually, this is really my bread and butter, and unfortunately, on a national level, a lot of this was predictable in some ways. There were a lot of unknowns and new things that we did see with COVID, but there were also a lot, the supply chain issues, a lot of things that were predictable, the healthcare surge. And, we can do our best in terms of taking lessons learned. I mean, things like the stockpiled supply chain. We now have a massive city-based stockpile of personal protective equipment that will be able to withstand another surge like we saw, and maintain essential services both on the outpatient and the inpatient level. We are meeting every day to talk about forward planning and how we can maintain better preparedness, beefing up our surveillance systems. I think in New York City, we have very good surveillance systems. Nationally, it's very spotty. So, there's kind of what we can do locally and what has to be done nationally. And, so we are certainly in a lot of conversations to how to capture these lessons learned and implement them for preparing further for future events like this. And we are working very closely with our national colleagues as well, and on the federal level, not just the city and state.
Hi, and this is Anna. I just wanted to add to, a lot of things that Dr. Foote said. Just to, so backtrack, we have been all hands on deck for over 9 months, and we're informing New Yorkers about COVID-19 in February, and staff have literally been working hours round the clock. And we were operating with the information that we had, without much leadership, as we should have in a pandemic from the federal government. We updated our information as we got it, and including the latest about asymptomatic spread, masks, guidelines, and the such. So we are in a totally different place now with testing, tracing, and understanding of the virus, even though that's also constantly evolving. And we're collaborating across agencies with healthcare partners to ensure preparedness, and are working with community partners to get buy-in. Issues in the data, we're taking a hyper-local approach to surge testing, distributing of face coverings. As Dr. Foote mentioned, cities prioritizing resources and support service where data show low test rates and a high percentage of positive tests. We try to engage the whole community and increase testing rates. So these neighborhoods would have testing sites that deliver results within an hour, and this is put together by the Test and Trace team, trying to bring wraparound services into the community and lower transmission. And to speak to that a little bit, there's also microsites that Tustin Crease puts together. So this is, directly, working with the T2 campaign team on specific like events and outreach. But, for a microsite, that's a location that is near high foot traffic and public transportation for access to direct population. For example, like senior housing, housing developments, shopping centers, stuff like that. Access space inside or outside from approximately like 10 a.m. to 4 p.m. and a staff point of contact who will remain on site for the duration of our time in the space. A table, 2-3 chairs that just for the setup aspect of it, and access to a restroom for the staff members. And then the host organization can take responsibility for promoting getting tested at this microsite. But that's something that's available, and if interested, I can put you directly in contact with the T2 campaign team to do this. And then in terms of, what lessons Department of Health learned, and so far, Dr. Foote was able to describe a lot of it. But overall, we are learning a lot about the virus itself and how it spreads. We are still learning about immunity. We are learning about working across partners, including with small businesses, to make sure everyone has the right information at the right time. On our website, there's also the posters and flyers page. So for any businesses that want to have those flyers and posters printed, they can call 311, or if you want, you can connect with me directly and let me know any of the information, any of the flyers that you want in any of the languages that are available. We can have them printed and mailed directly to your office as well, so you can help disseminate this information as well. And we're working closely with trusted community partners and are always happy to do webinars, town halls, anything that you need to get the info out, try to get someone from the Department of Health to join and speak to questions that you have. And we've got nearly 500 speaking events since March, and that doesn't include all like the one-offs that we've had as well with like electeds and community boards as well. So hopefully that helps to answer your question.
Thank you to you both. I really appreciate that. I just want to say real quick, it's less of a question and more just a clarification that I was even just thinking about the ways in which, regardless of the type of disaster or health pandemic it may be, just some sort of standard operating procedure for all New Yorkers, so that we know, these are the depots where we're lined up, and these are the last names A through M that go on Monday, Wednesday, and Friday to get food, and so that we don't create this sort of logjam and all the kind of chaos that was happening near the beginning, because, we are such a quote unquote liberty-oriented society that it's hard to have these mandatory things. So it's like, how do we get people to voluntarily choose to lock down, and how do we sort of move that along? But thank you both for your explanations.
And quickly, Brandon, if I can, I wanted to pass it over to Latrell, who's another CB2 member on the line and has a question.
Hi, Latrell, we're really happy to have you here. Feel free to introduce yourself and ask your question.
Hi, good afternoon, everybody. My name is Latrell, and I'm a community board member. My first question is, Cuomo stated that how we're monitoring people traveling in and out of the state on buses and airplanes, but what about for people who travel in and out of state in vehicles? How are we monitoring them?
Yeah, sorry, I was waiting to see if Anna had anything to say. We can't speak as much to the governor level travel order because we actually haven't gotten very detailed information about the enforcement of it. So unfortunately, we may have to refer you to the, to the governor's office until we get more information. But we have similar questions ourselves. Let's say that.
And my other question was, a lot of people before the virus had a lot of serious underlying conditions. And from my understanding, after the virus, a lot of people, there's more, people with health concerns. And I remember seeing something on the news a few months ago, like there's a facility in Manhattan and it's a 300, and it's like they house like 300 and some people. It's an in and out patient clinic and there's a waiting list. How are we dealing with, I know about that facility, but how are we dealing with the concern in the long term for people after the virus? Because there's a lot of, different underlying health concerns being shown.
You mean specifically after somebody recovers from COVID?
Yes.
Yeah, no, that's actually a fantastic question, and I've been working on that a lot this week. So very apt timing. Yeah, so right now, actually, what we're doing is compiling a list of the clinics that are dedicated to, the post care of a patient after they've suffered from COVID, especially severe COVID, where they're having residual health problems. And it is a big issue, and it's a really big concern because, we're seeing now it's not just the lungs, obviously, it's really every system in the body can be impacted and have long-term effects. So that actually list should be up on the website, we hope next week, but there are several within all 5 boroughs, including Staten Island, run by the different healthcare networks. And those are, we're really focusing on the clinics. And I think you might be probably talking about Mount Sinai's clinic. They were really the first ones to set something like this up. And these are specialty clinics that are really one-stop shops where you can access multiple services and specialties. And in terms of being able to access it for people that, have uninsured or underinsured, New York City Health and Hospitals is going to be opening 3 sites in Queens, Brooklyn, and the Bronx that are COVID centers for excellence that will be specifically dedicated to this type of care that will be able to offer free or low-cost services.
Yeah, because the disability number will increase even more for disability.
Yes.
Also,
absolutely.
how many is going to be in CB2? Mine is Mount Sinai. Well, I assume you're talking about the Mount Sinai in CB2.
I'm sorry, what was the question?
You said that Mount Sinai is going to be one of the places that's going to be opening up the clinic. And we do have a Mount Sinai in CB2. How many other facilities in CB2 do you know of that's going to be opening up?
Yeah, that I don't know. Mount Sinai actually has just the one location that's going to be in downtown Union Square for now, and I am not sure where the Health and Hospitals location is going to be. The Brooklyn Hospital Center does not have one at this point, but yeah, so I'm not sure what's going to be available in Brooklyn and from the H&H side, but
so how can we go about to see if we can get one in our district and Community Board 2 district, so we could be?
That's a very good question. It may be something to advocate with the Brooklyn Hospital because they certainly, could be a good site for that. And that's something that we're, like I said, we're just starting to kind of compile the list and put out feelers, but we can certainly advocate for that as well.
Thank you.
Sure. Thanks for
Thank
your question.
you. Ms. McKnight, you had a question?
I do. I have a question related to community healthcare providers. I know there's been articles related to the fact that there's been lower utilization of services. And I just want to know if you have any information on how these community healthcare providers are surviving with the fact that there's lower utilization. I know the federal government had issued some provider relief funds. I don't know if New York City has really accessed that or not. There hasn't been that much information I've been privy to.
Mm-hmm. Yeah, no, that's a really good question. So looking at the data that we do have, looking at independent practices and federally qualified help centers, utilization actually looks like it's at or near baseline for this time of year. So it's fortunately bounced back pretty well, in terms of utilization, but obviously people are really still suffering major economic impact from before. So yeah, so definitely there were a lot of clinics that did apply and received money, especially for the Paycheck Protection Program. And I think probably what has made the biggest impact and has helped a lot has been the just changing of the reimbursement for these remote care telehealth visits and other, just better payment structures for this kind of services that they're providing right now. So, there are definitely some, especially the independent providers, have been hit pretty hard, and some have shuttered for good. But, as of now, there are, structures in place to help support them, those that have been able to stay open. Yeah, and hopefully there will be another round of funding soon to help support outpatient services and federally qualified help centers especially.
Thank you. Any other questions from members of the committee? Any questions from any of the members of the public who are here at the meeting?
Excuse me, Brandon. Barry had earlier indicated he wanted to speak.
I'm sorry, who had indicated they wanted to speak?
Barry.
Oh, Barry wanted to speak. Barry, the floor is yours. I believe you're on mute, though. Are you able to unmute, Barry? Oh, there we go. Good.
Yeah, sorry, I think I just did. Actually, as is often the case, Alejandro asked a lot of what I was interested in, and Dr. Foote and Ms. Schatz, you were kind enough to provide a lot of answers and responses to those questions, which I know we all appreciate on the committee, and we appreciate your being here. I think rather than ask a question, I'd just like to offer my opinion and observation, which is that you're a department within New York City, and you're dependent on a lot of political issues and other issues that help you and also hinder you as a department in carrying out your mission, which I appreciate and I understand, and I think probably everybody here does. And New York City is also at the mercy of New York State. Unfortunately, for a lot of things, home rule does not really exist in New York City for important things, and we witnessed that most recently. And New York State's dependent on the rest of the country and the United States government because we're all one big crazy family. And usually in times of crisis, we come together to help each other, and we see the best in most of us. And unfortunately, except for what we've seen from people we know and trust, that hasn't been the case. So you guys were really up against it. All I really want to, again, say is that I've done a lot of work in dealing with crises in communities and the aftermath of those crises, and in planning how to reach out and engage with communities. And what always happens is things go down, and even though, what's the old saying, an ounce of prevention is worth a pound of cure, we don't do it as a society. We just don't stick with it. And Alejandro was getting to another point, which I was thinking of during the conversation, which is that there are lessons to be learned from this experience, as with every crisis that has confronted New York City and New York State. And it just would be a shame that this again becomes one of those times where we don't spend the effort, boring as it sometimes is, in planning and setting up the kinds of systems that Alejandro was alluding to, so that we can move into those relatively seamlessly, aside from the chaos that any crisis brings. But this is something that we have to stick with. We have a Department of Emergency Management just across the street from where I live. And I don't know what the heck they were doing during all of this, to tell you the truth. I saw lights on in the building, but, you know, I have to say I'm cynical about the level of support that you guys received in trying to manage this crisis. You guys really had your hands full and more. And, you know, having 500, 600 meetings in such a short time as Ms. Schatz, you described before, is a great thing. But we had some communities like Borough Park, like Williamsburg, where the politics and the people who really exercise influence are very well known to the politicians in New York City. And with all of that, we had chaos. So, and that you had no control over. And I appreciate that. So I guess in closing,
Barry, I'm sorry to cut you off. It's just Ms. Foote has got to get going in 2 minutes. So I want to make sure that she.
I was just going to end. And
that's fine.
Thank you again for coming out. And nothing I said was a criticism, Dr. Foote, of you or Ms. Schatz or the department. And I hope you didn't think I was doing anything of that. I was really joining you in what I think has been, you know, a tremendous effort that you've made as a department to help us in New York City. And just please carry the message forward about how this kind of planning and systemic preparation is critical for any city like New York City and going forward. And if we don't spend time on it, we're going to find ourselves, you know, from square one again. Thank you, Brandon, for being so generous with the talk.
Thank you, Barry, for your thoughts.
Yeah, and thank you, Barry, for your remarks. And I, all I can say is a big ditto. And we hear you, and believe me, the work is being done as best we can.
Thank you very much, Dr. Foote. I think I had a question for Ms. Schatz, if maybe. So it's okay if you drop off. But
yeah, thanks everybody. Thank you for the invitation, but I have to jump off. So
no
have a good evening.
Thank you. It's a
happy
great
to answer.
presentation. We're really appreciative.
Okay, but I'm happy to answer any follow-up questions through Ms. Schatz. So have a good night.
Okay,
thank you.
Great, thank you all. Ms. Schatz, I just wanted to ask one other follow-up question that wasn't completely COVID focused. Because our committee has been very concerned about the community health profile that was issued by the Department of Health, whom might we follow up with at the Department of Health, or could you potentially take the message that we would like a more granular examination of the areas most impacted in our district whenever the next community health profile is produced?
Yeah, absolutely. I took this down when you mentioned that earlier as well, and I will be flagging it up chain in terms of, you know, you mentioned like the NYCHA community district as well.
Yeah, that's absolutely the case. Yeah, I mean, I think it really can just be best termed by the fact that the profile reads describing our community district as, quote, Fort Greene and Brooklyn Heights. And, you know, obviously we have a great disparity of people who have wonderful health experiences and other people who have less access to care and other health disparities in our community. And when you merge it all together into one profile and say, this is what's going on across the board, it looks like we may be one of the better profiles in the city, but it really needs to be, the story needs to be told about the places that are most impacted within our district because they're experiencing the real challenges. And we don't want to make it seem like they're part of a story that's better than it really is for those folks.
Yeah, absolutely. Thank you for your comment. I'm noting it and I'm going to bring it back to our teams.
Any other questions from the committee or any members of the public for Ms. Schatz?
I have a question. Hi, it's Emily.
Oh, Emily, hi.
Hi.
The floor is yours.
Hi. Sorry, and I'm gonna, Ms. Schatz, I'm gonna try to think of how to ask this question. Has New York thought, because I'm always struck by how many people I encounter that have never been tested for COVID, and obviously like a test on one day doesn't, mean that your results, the next week still hold the same, especially if you're out and about in the world. But again, I'm so struck by the fact that we're, 8 months into this and the number of people that have never been tested. And so I wonder, has the state or the city, or I don't know at what level, considered paying people to get tested? And I know that sounds kind of crazy, but I guess the thinking is if you can identify someone who has it and you're fundamentally then saving the health costs and the costs on the system to take care of them or to take care of the people who they may go on to infect. I don't know. I guess I'm just struck by the number, and it sounds like you're identifying that there are places where there's low rates of testing and of COVID. And I'm just thinking about things where you hear in the news, like, for example, the South Dakota bike rally, it would have been cheaper to basically pay all those people $10,000 to just not go to the rally for the costs that were then inflicted on the system. And so I'm just wondering for New York, like, what percentage of people have been tested? And again, if potentially crazy measures like just paying people to get tested have been considered, just so we actually have a full picture, and given obviously what asymptomatic spread does. And yes, I'll stop there.
Yeah, no, thank you for that. It's a great point and a great question. So this would be a best question to answer by the Health and Hospitals Test and Trace team, as they're the ones that are doing all of this. So I'm happy to get you guys in contact with the Test and Trace team to help address this question in terms of the, the folk that have not been tested at all during COVID and what the approach there would be.
Yeah, and I guess I'm just thinking about even like specifically as we talk about like Fort Greene, where you have such great disparity, and if it just honestly what it would do and if it would be helpful to just like go into pockets, particularly if we're understanding there to be low incidence of testing, and incentivize people to get tested, again, with the idea being the greater savings to the healthcare system if you can identify people early on. But yes, I will follow Brandon on that and crazy thinking.
Right. Yeah, I will get you in contact. And also, as I mentioned about the microsites, maybe that's something that you might be interested in doing as well at the community board.
Yeah, love that. Especially, I'll connect that, Brandon, with the Fort Greene Park Conservancy to see if that's something we could potentially do on Myrtle. That would be amazing. Yeah, so I'll follow up Brandon to get the dots connected there.
Okay, thanks, Emily, and thank you, Ms. Schatz. Were there any other questions for Ms. Schatz? We have been joined by another community board member, Mr. Harrison. Do you want to introduce yourself and feel free to make your point?
Yes, thank you, Mr. Chair. You have it's not a question, so I'm not sure that I should raise this now, Brandon. It's really an observation. But it does involve Ms. Schatz, and it did involve our colleague, the good doctor who had elsewhere to go. So I don't know if you want me to make this at this time or you want me to hold off.
John, if you want to raise your thought, you can raise your thought. I just, like any thought, I want to ultimately, this is a secret about tonight's meeting. I'd like to avoid having a 4-hour meeting tonight like we did last month. So I would like to try to keep things somewhat succinct.
If I could, I'd virtually, let me do a virtual hand pump, Mr. Chair. So my point is this, and I think what I'm about to express, I will do succinctly, and it's me, Brandon. So, I'm going to try to keep myself to my standard of succinctness, but it's, I felt the need to express this because I expressed it as best I could in a document that was circulated by one of the community board office staff as it applies to district needs. Or maybe I have that wrong. Maybe it was budget. I do believe it was district needs because a lot of the questions or a lot of the points that came up in that document were COVID related. And it's simply this. I feel what my colleague Barry has said, but in a slightly different way. You know, I think he used the word jaded or something like that. And I don't see Barry at all as jaded. But coming from, you know, full disclosure, right? Coming as an officer of the New York City Department of Social Services, I have a slightly different perspective than many people on, and it is definitely tempered by 30 years of service with the city. And so it comes down to three things, and I tried to say this succinctly in the document. One is expectations about just what the city and its you know, with this mayoralty with the city is kind of expanded to include, you know, some nonprofits that work with the city or for the city, they get contracts. But I'll just use the word the city to sort of cover all that. One has to do with the expectation, just in general, on how the city, at what level the city can respond to a crisis. The second one, and sort of to keep in mind with COVID, and it's not to let anybody off the hook, but my feeling about it is the city has done a pretty good job because there's A, massive numbers of people, B, there's little precedent in recent history to this kind of a crisis. And third, it's something that I referenced in the documents. I think one of the important points for the committee and for the board, and just in looking at this crisis, but in the larger context of a crisis, that the crises has come and they don't almost ever come in the same form, right? So in our lifetime as adults in this city, we have dealt with other health problems, but we have dealt with dealt with Hurricane Sandy. And the reason I bring them up is because time and again, often the public, I'm not saying this board, but often the public will criticize the city for its preparedness response. But it comes down to numbers, folks. When you talk about the millions of people that live in the city and the amount of personnel and other than personnel allocation of monies you'd have to have for every kind of a possibility of a crisis. That's why I stressed in that document, and I think in emails discussing the budget priorities, it's kind of good if some of the city agencies can project maybe possible crisis so they can sort of put their money in that bucket, because there's just no way New York, whether it's or anything else, can anticipate all permutations of all possible crises and then prepare them by stockpiling masks and having a huge, just vast blood supply and having all the roads repaired. So it comes in different forms. So that's one thing. It has to do with expectations. So to say, well, you know, the city should have done this. Yes, the city should have. And the city could have done this. And yes, they could have. But it all costs money and it takes planning. And you really, the real planning is not, well, next time having, I don't know, whatever, billions of masks sitting around or billions of hand sanitizer. To sort of move towards anticipating what the next crisis might be and then preparing that way. The second thing I want to say was—
Mr. Harrison, we are very tight on time. Do you have something that you want me to capture succinctly in the notes?
Yeah,
Do you have a question or anything?
The second thing I want to say, one of our colleagues has brought up the thing of tracing and testing. And that's a good thing, but more fundamentally, right off the bat, because it's great to know if someone's got it, but more importantly, you know, you can, people have not been tested, and you know, there's not testing in certain pockets, community board 2, or certain pockets in Brooklyn or the city. But it's much more important that everybody be wearing masks. And from the southerly and easterly that I hail from, non-compliance, whether it be in this neighborhood or be when I go out to my job in the city, non-compliance with wearing masks is just pervasive. So, and so that's just a basic thing, and that has to do with behavior. I don't know how you do that, and I'm not saying that testing is not important, but I think fundamentally, getting more people to wear masks would help a lot. Thirdly,
before we do thirdly, John, I'm just going to come back to you in a second on that. Ms. Shads, I want to be cognizant of your time, and if you need to drop off, feel free to drop off. And John, I don't know how many total points you have to raise, but if you can cover the rest in the next like minute or so, then that would be good.
That whether it's the health department or it's emergency management or any of the city departments, it all comes down to money. So if we talk about, well, you know, if we can reach out and pay people to go get a test in this crisis, I will just tell you that's not going to be possible because the budget is already bust with the city. So we have to think about this thing in an anticipatory than a Monday morning quarterback. That's my point.
Thank you. Ms. Schatz, did you want to respond?
Yes, I just, you know, in terms of thank you for your comments, you know, I'm always happy when joining these hearing, you know, feedback just so we can have a two-way conversation between, you know, the opinions and the thoughts and concerns that are happening within the community and bringing it back to our team that, you know, does the guidelines policy and all of that work. So for that. And in terms of compliance, as I mentioned before, you know, we're trying to get people to follow the core four as much as possible, you know, staying home if you're sick, wearing a face covering, social distancing, and, you know, getting tested, washing hands with soap and water, using hand sanitizer. So, you know, we have a lot of graphics that you can share on social media, and there are the posters and flyers that we can mail that you can help us spread out in the community for people to post it as a reminder. You know, this has been a long time in the pandemic. There is a bit of a fatigue of hearing the same message and maybe just dropping off on compliance, but you know, happy to push that core four messaging over and over and over again. So you know, visit our website for all the guidance for the, you know, anything that you need us to mail, and any questions that come up, please feel free to follow up directly via email with me or Teja Mare, who's your representative.
Thank you very much, Ms. Schatz. Greatly appreciate that.
Thank you for having me, guys.
All right.
Thank you.
All right, I'm going to move along to the next item on the agenda. Before we do that, I just wanted to give Ms. Church the opportunity to introduce herself because I'm sorry I didn't acknowledge her once again earlier in the meeting.
I'm sorry. Hi, everyone. I'm Carol Ann Church. I'm the Assistant District Manager. And staffing this meeting tonight, also not on screen, is Taya Mueller, who's running the Webex.
Thank you, Carol Ann. Thank you, Teo, also. All right, next up on the agenda, we've got our liquor licenses. The first new on-premise tonight is 57 Front Street, EM Dumbo. M. Dumbo, do we have somebody here from that location?
Hi, my name's Frank Lillo.
Hi, Frank.
How are you guys?
Just gonna ask him for everybody here for a liquor license. If you're presenting your application, then please don't present the signature portion of your application. We try to avoid that as a committee. But do you want to go ahead?
How are you on? I saw my clients had signed in.
Patrick, I'm here.
Patrick, how are you?
Good.
Do you have a PDF to share with us? Are you able to share your screen?
I can't share my screen. I emailed it to the community board. I thought you guys all got it.
Okay.
Sorry. I'm actually on vacation.
We do have it, but we generally prefer for the applicant to run the presentation. Does either Mr. Ng or whom else? Either of you have the
Mr. Lin?
presentation? No? Okay, I can do it.
Thank
I'm
you,
sorry,
Carol
guys.
Ann.
I'm working off an iPad, so I can't do that.
Thanks, Carol Ann.
I have the materials, but
Thank you, Carol Ann.
Excuse me, Taya, can you give me sharing privileges? Thank you.
Oh,
Thank you. Just give me 1 second.
Ms. Church,
See my screen?
not quite yet.
Mr. Palillo, if you want to start talking about your application, I think that's probably fine. We'll be able to present it shortly.
that's great. Patrick, you want to give them a brief overview as to what we have in mind there?
So we're opening a Vietnamese restaurant. It's my second one. Howard is one of the partners there. We're doing Vietnamese food. My wife is the chef.
Okay. Yeah.
You can continue.
Ms. Church, we can see your screen now.
Yeah, that's funny.
So we're requesting a full liquor license. We have a lot of inventive cocktails that we had in mind. Our previous restaurant was featured on the New York Times Top Cheap Bites 2018 for our smoothies. So we were thinking we were going to do some really interesting smoothies.
Well, our restaurant hours will be 11 a.m. to 9 p.m. Monday through Thursday, Friday and Saturday, 11 a.m. to 10 p.m., and Sunday, 11 a.m. to 10 p.m. Background music only.
Excellent. It looks like there's an outdoor area from the application. What is the outdoor area? Is it within the property line, a sidewalk cafe? What is that?
Actually, no outdoor area. We figured when we were filling out the form, we were doing outdoor dining because of the city's program. But under pre-COVID, there was no outdoor space.
Right, and the plans don't show an outdoor space, so.
Okay. All right. Questions from members of the committee?
When do you anticipate opening, and how many folks do you plan to hire?
We hope to open next month. We're waiting for National Grid to come in to increase our gas line. Hopefully we will be able to hire about 10 to 15 people, depending on how much the city is allowing for indoor dining.
Got it. Mr. Varela, do you want to, not to put you on the spot, but give the spiel on the hiring?
Just the one that I would give to every applicant here, and I'll remind as it pops up, is that our highest concentrations of unemployment are in Black and brown areas of CB2. And so it would be great if you hired brown and Black people, and not just in the kitchen, but in front of house too.
Sure.
That has no bearing on your application.
Right. Any other questions from members of the committee? Okay. Any questions from members of the public for this application? Okay. I'm not seeing any. Thank you very much.
Mr. Smith, Ms. Emily Onadu has her hand raised.
Oh, sorry. Emily, do you want to ask your question?
Sorry, that was an accident. I just hadn't put my hand down yet. My arm is so tired. I'm going to put it down now. Sorry.
Okay. That's fine too. All right. With no further questions, does anyone on the committee want to make a motion in regards to this application?
I make a motion
Is your motion to approve, Victor?
Yes, I approve.
I second it.
Second by Barry. Discussion on the motion?
Did someone ask about residents, like private residents? If I missed that, is that the first question that Jessica asked?
I think so.
Oh, no, I didn't ask about that, whether they're a nearby residential.
Yeah, is there a residential building? Do they have any neighbors across the street, either side?
Mr. Palillo, Patrick, Howard?
The building is residential upstairs. Across the street is a construction site.
Have you all spoken with the neighbors upstairs?
Yes.
Okay. There been any concerns expressed?
No.
This project started actually pre-COVID and we took basically the spring and the summer off, and we're back into it. So the neighbors are well aware of our presence.
Any other further discussion? Hearing none. I'll take the members of the committee's vote at this point. Mr. Newmark, how do you vote? Favor? Ms. Thurston?
In favor.
Okay, Mr. Harrison?
Yes.
Okay, Ms. McKnight?
Approve.
Okay, and Mr. Andrews?
Approve.
Great. I think that's everybody this evening. I also vote to approve. So unanimous. Thank you very much. Next item on the agenda, 673 Atlantic Avenue, the Simpson Restaurant. Do we have someone here from that location?
Me?
Sorry, who would that be? That's you
Frank
again,
Pullo,
Frank?
sorry. Frank Pullo,
Great.
yes. Jeff
Great.
Patrick?
Yes.
Introduce yourself, sir.
I'm sorry, I didn't get the question.
No, you're done, Patrick.
Oh, okay.
Mr. Lynn, before you get started, is this the same situation as before, Mr. Palillo, where we need to get the presentation up?
Yes.
Okay.
Yes, but Mr. Lynn was the last case. He had nothing to do with this case.
Okay. Okay, that's fine.
Patrick, you can sign off.
Okay, got it.
Ms.
Okay,
Church, Ms. Church, could I humor you again for helping us with presenting this application?
Sure.
Thank you.
Sorry, Caroline.
Okay, Frank, enjoy.
Yes, I'm trying to.
When I open. Are you seeing this?
No, we don't. In the meantime, who else will be presenting this with you, Frank?
Myself, Winford Simpson.
Hi, Winford. Thanks.
Hi.
You know when you're seeing.
To tell the folks a little bit about yourself.
Yeah, okay, guys. Thank you so much. It's definitely a pleasure being here. Hope everyone is safe and everyone is good. Just want to quickly introduce myself. Originally, I was born in Jamaica, but I live here in New York with my family. My mom, my dad lives in Florida. I fell in love with cooking from I was probably around 10 and fell in love with cooking basically out of poverty. So over time, I was the executive chef for BB King's, which is the 42nd. Also the executive chef for Highline Ballroom and also City Hall. One of my passions is to always open my own restaurant, which I just did. And I'm all about great vibes, great energy, also great food. So my restaurant is mostly going to be soul food, Caribbean American. There are not going to be any live music, probably only on occasion if there's a private event or something that's going on. But most of the music will be from the house system. If I can interrupt you for a second, Patrick. The hours of operation are Monday through Thursday, 11 a.m. till midnight, Friday and Saturday, 11 a.m. to 1 a.m., and Sunday from 10 a.m. to 10 p.m.
background music and occasional live music. The chef has, for years now, been catering private events at different locations for clients. So he does intend to do a large amount of catering at this establishment. So there will be private parties and corporate events and things like that. Did I say that correctly?
Yes.
Okay. What proximity would you have to any residential housing? And the outdoor area again is referenced on here. Is there any outdoor area within the property line or a sidewalk cafe, or is this if that could be clarified? Yeah.
I don't think there's any outdoor area.
No,
Patrick, am I right?
no, there isn't.
At some point, we were looking into the possibility of a sidewalk cafe, but I don't think we've gotten a definitive answer on that. So for this application, there's no outdoor.
Do you think that you could amend the application a little bit here with the hours to make it clear what is AM and what is PM specifically for each one? Because it seems like the word PM and AM is written in these different locations, and it want to make sure that that's clear.
Well, I thought it had open and close.
Yeah. But it says you're implying 12 p.m., for example, for the close, after each actual number,
Yeah,
if
that's
you
actually,
write AM
that's
or
actually, yeah, that's my fault. That's dumb. All right, we can amend that. I can send that to the office tomorrow. We will
Great.
not be closing at noon.
Okay.
We'll fix that and I'll send it to you tomorrow.
Are there any residents that live above or adjacent or across the street?
Yes, there are residents that live above. And there's a condominium. There's a condominium that's going up across the street. So yes, there will also be resident across the street.
Okay. I'm not so concerned with across the street. This is Atlantic Avenue, so there's probably going to be a lot of traffic. But the folks who are up above, have you spoken with them, and have they expressed any concerns to you?
Yes, I've spoken to a few of them. A few of them wasn't there because of social distance and so forth. But no, they didn't have any concern. And I also had a board. I met with them over Zoom with quite a few of them, and met a few of them in person as well.
Okay. And I guess from the understanding Mr. Palillo gave, you're going to be having kind of gatherings or private events in this space?
Well, I do. Away from it being a restaurant with also a sport bar theme, every now and then I'll have somebody who they have a little birthday party or a baby shower or something like that. So if someone want the dining room for a private event to celebrate a birthday party, nothing with live music or anything like that.
Okay, so that
get together.
So that's it. It's not like you're opening this just for special events. This is
No.
You would do that if there was a request for it. I understand.
Yeah.
Okay. Any other questions from members of the committee?
Yes, I have.
Yeah, Mr. Chair.
May I go ahead, Brown?
Mr. Newmark?
Thank you, Mr. Smith. I have a question. I'm not sure if this is the correct application. I apologize if I'm wrong. But when I was reading the applications the other day, are you guys planning to have security at your location?
Well, yes, for a reason of just to make sure that everyone remains safe. So security will be there on particular nights, just to ensure safety for all the customers that comes in. So if there's ever a situation, there'll be someone there to handle it and make sure everything is okay.
Thank you. I'm just curious. I know your occupancy, if I recall correctly, is a few hundred people potentially at a time, maximum occupancy. Is that
yes.
Correct? So how did you arrive at one or two security people for several hundred people? I'm just curious. How did you come to that?
Well, because of the way in which the room is set up, the room is set up in different sections. So you have the dining room section where it's more seating, and then you also have the bar where you have the left and the right. So it's based on how it is set up from the dining room side to the bar side, and just you basically need either one or two security there on any given night just to make sure everything is okay. And it's a dining room environment. It's not like a nightclub or anything where people are dancing and getting crazy and start a fight or anything. It's mostly coming in to dine and have a drink, or they come to eat some dinner or celebrate a little get together. That's the kind of environment it is.
Okay. And my last question, I appreciate your answers so far. Have you had experience in any of the other establishments you've worked in where having some security present was helpful?
Yes. As I said, I was the executive chef of BB King's. And as you know, BB King's on 42nd Street. We hold 1,100 stand-in, and we always have multiple security. And also for seating and dining, we seat 500, and we also have security. So I'm very familiar with the security environment and how to approach a customer if they're intoxicated, if they have too much to drink, if there's a situation. I'm also a manager. I've been a manager for many years, so I definitely know how to diffuse a situation.
Thank you very much, Mr. Simpson. I appreciate your answers.
If I can just add something to what the chef just said. Security and soundproofing go hand in hand. This is a residential building overhead. The last thing he wants to do is be a nuisance to his neighbors. The premises are soundproofed. We're going to add to this existing soundproofing. And the security was basically, we don't expect to really, and you usually don't put security in a restaurant. Because of the size and the residential nature of the building, he thought it was the best idea to have security there.
Yeah. And one of the reasons just also I've cooked for over 400 celebrities here in New York. So a lot of celebrity is going to be at the restaurant. So for their safety and also for the customers, if a celebrity is inside, say Jay-Z or Beyonce or any one of them come to dine, we just want to ensure that everyone is safe while they're there in the restaurant.
Mr. Chair?
Thank you very much. Are there any other questions from the committee?
Mr. Chair?
Mr. Andrews.
Question, Mr. Simpson. Do you guys have accessible bathrooms on the first floor? How is that going to work?
I'm sorry, I didn't hear. Can you repeat?
Are there any accessible bathrooms on the first floor?
Yes, there are.
How many? 2 or 3? Or?
There's a male and female and also a handicap bathroom available.
And all this is on the first floor, correct?
Yes, all is on the first floor with a ramp that goes right up to the dining room area.
And what about coming in? Coming in,
yes, it's ground floor. So coming in, there's a ramp to come in where you get there, and from there, there's a ramp to take you right to your table. Or if you want to go to the bathroom, there's a ramp to take you wherever you want to go within the vicinity.
Oh, okay. Thanks, Mr. Simpson. Appreciate it.
You're most welcome.
Any other questions from members of the committee? Mr. Varela?
Did you say how many people do you expect to employ?
Anywhere from 25 to 30.
30. And is this, just to clarify, this is directly across from Barclays. This is the place that was not too long ago. This is maybe more for my fellow committee members in the last year and a half or so that came in, not this applicant, for it was a vegan restaurant. Does that ring a bell? Is it the same space?
No, it's not directly across. It's just up the block, like a little bit up the block. Across from the Barclays is the Best Buy and the ShopRite, Stop and Shop.
Okay.
I am just up the block. That's where Atlantic Social used to be.
Right.
Right.
Yeah, I think we are that is what you're thinking of. Miss Church was not.
That's exactly the place. Yeah. That's exactly the place. Okay. Thank you very much.
You're most welcome.
Thank you. Members of the public, are there any questions for the applicant? Not seeing any. Trying to double check my raised hand feature. No. Okay. Thank you very much. Does anybody want to make a motion?
I do, Mr. Chair.
Moved by
Second.
Mr. Harrison. Do we have a second?
Second.
Second by Mr. Andrews. Discussion on the motion? Hearing none, I'll take everybody's vote. Mr. Andrews, how do you vote?
Yes.
Mr. Newmark,
Yes.
Mr. Harrison,
Yes.
Mr. Varela,
Yes.
Ms. Thurston,
Yes.
Ms. McKnight,
Yes.
and I also vote yes. Okay, thank you very much.
So most definitely, one last thing I would love to add. Something that I do a lot with the community, where I go around to schools and colleges and speak to kids about staying in school and focus on their education. I'm presently in the process of opening a culinary school. Is my way of giving back to Jamaica and just try to help out some of the youths on the street. So one thing that every now and then you'll see, if I'm at the restaurant, I'll have cooking classes where I take kids who want to learn how to cook, and I'll have them in the restaurant to teach them how to cook and so forth. Just my way of trying to keep them on track so they can stay focused. You go on my social media, you'll see me with a lot of kids at the schools. Of just my way of giving back.
I applaud you for that, Mr. Simpson. Thank you very much. We really much enjoyed your presentation and look forward to having you in our community.
Thank you so much. Greatly appreciate it.
All right. Next up on the agenda tonight, we have 121 Bridge Park Drive, Brooklyn Bridge Park Cafe, Inc.
Hi, how are you?
Hi, good evening.
Good evening. I hope everyone's having a good night. My name is Beatrice Martinez, and I am the owner of BBB Cafe.
Yes, I'm Anthony Carabello, her representative. This is for an on-premises liquor license in Brooklyn Bridge Park, Pier 6. The corporate name is BBP Cafe. The DBA is Iris Cafe. The hours of operation will be 7 a.m. to 10 p.m., 7 days. There is seating for 50 inside with 13 tables. There's outside seasonal seating for a patio. It's right off the water on Brooklyn Bridge Park. There's seating for 32 with 8 tables. Background music only. There will be 9 employees, and we'd be thrilled to address any questions the committee might have. Thank you.
Thank you, Mr. Carabello. Questions from the committee?
And thank you, Caroline, for putting that up.
That's Taya.
Thank you, Tay.
What about accessible bathroom? I have to ask that question again. I'm sorry, but
yeah, there's an accessible bathroom. It's a 1-level premises, if you can see from the diagram, and the bathroom is accessible to patrons. They do have a bathroom.
Accessible meaning for wheelchairs, am I correct? If need be?
Yeah, Beatrice, this is being built to code, so it has to be handicap accessible, correct?
It is.
Yep.
Okay. What is the outdoor area at this location?
So there's some seating in front, which you would have a view of the water. And it's not in the jurisdiction of Sidewalk Cafe. I think this is Brooklyn Bridge Park property. So they have the consent of the landlord to put some tables out there on a seasonal basis. It's part of the ambiance over there to be right off the water.
Yeah.
I have a question, Mr. Caraballo and Ms. Martinez. Can you explain where you're actually located in Brooklyn Bridge Park? I had a hard time trying to figure that out.
Yes. So it's essentially, if you go down Atlantic, you go down all the way down Atlantic as far as you can go. You make the Columbia, you make a right, and then you make the first left. And then you walk all the way down as far as you can go, and there's retail space there. It's quite beautiful. The view is phenomenal. As soon as you make the right at the end, they're right on that corner. It's retail space. It's new. It's been recently developed. And then you make the right, and it takes you all the way into Brooklyn Bridge Park, the pier. There's a dog walk. There's a lot of fields there. There's an ice cream shop down the road. There's the marina, if that will familiarize you.
Okay, I got it, I think. Thanks a lot, Mr. Caraballo.
You're very welcome, sir.
Any other questions?
Yes, Mr. Chair, I have a question for Anthony.
Hi, John.
Okay.
Okay, so I was actually going to ask this to the last applicant. Might be more applicable here. I don't know that it's applicable at all, but rightfully, often Mr. Andrews is asking the questions about handicap accessibility. I'm wondering, Anthony, what would your client do if someone came in who was blind and wanted to order? Is there going to be a menu available in Braille, or is there some other someone who wants to know the menu and they can't read it?
Beatrice, yeah, I'll pass this off to you, Beatrice. You can address that question as the operator.
Yes, we were going to have a host on staff that would help out our customers if they need any assistance with the menu.
Okay.
Or a waitress.
Thank you.
Thank you. Any other questions from members of the committee?
Just when do you anticipate opening?
Beatrice, you got a couple of months of renovations, right, and construction?
Yes. We're looking end of January, February.
So we're hopeful. We might get delayed with the Department of Buildings, but that's the projected opening. So you're looking at about 2 to 3 months.
Right.
Thank you.
Mr. Varela?
I was just curious. I heard earlier someone refer to this as seasonal. It'll be a seasonal business, even though it's
the outside seating, the outside seating, but it'll be open all year round.
Okay, and I already forgot my second question. Let's see if it comes back.
Employees 9 employees, and they will make every effort to hire locally.
Yes, I'm sure. Thank you very much.
You're welcome.
All right, I can't. If it comes back to me, I will. Thank you.
You're welcome. Thank you.
All right. Thank you.
It came back to me. It's a residential building. So do the signatures include people from the building? Have you heard anything?
So here's the thing. You know, I appear before you guys for many years. I generally bring sufficient amount of petitions, but with COVID, we didn't embark to get signatures due to the pandemic, and they really haven't. They're just getting possession of the premises now. But they're more than willing to meet with residents in conjunction with the landlord if there is any kind of tenants association. Directly on top of them, Alejandro, there's only 2 stories, which is like loft residential, which is not fully occupied. But if you go down the block, there are residential units. But they would make every effort to meet with them when they're on site and they're actually beginning the project.
I think maybe just because in the last few meetings or this year, we've had a few meetings where people have come back and complained about residents who've just complained about noise, about business owners, restaurant owners, hotel owners who are just they're not trying to respect their neighbors. I don't mean to assume, Ms. Martinez, that you would be one of those people. It's much harder to have these conversations after the fact, after there's a license. And my encouragement would be that if you do encounter neighbors who have concerns, that you'll meet them where they're at with those concerns.
Agreed. And we're a little encumbered now. We usually come in with petitions and we do the outreach. They did do the appropriate and required posting, but with all the community board presentations I make, a lot of boards have suspended petition signatures and the outreach protocol due to the pandemic, unfortunately.
Including CB2.
We don't do that. We've done the same thing. So nothing will be held against you for that regard. Thank you.
And also, Alejandro, if I just might add quickly, the closing time is 10 p.m. and there's background music only. So I certainly understand your concerns, but and there's nobody in the area of the water. So it's the building behind them and on top, and then it's open space and the New York Harbor. So in terms of quality of life for residents, I think that'll be minimal.
Thank you. I appreciate that answer.
Thank you. Any members of the public have any questions for this applicant? I'm not seeing any hands raised. With that, could I ask if any member of the committee has a motion?
I make a motion.
Mr. Chair.
Second.
Okay, I've got a motion by Mr. Andrews and a second. Was that Mr. Harrison with the second?
It was the opposite way, but that's fine.
Okay, I'll credit you, Mr. Harrison, with the motion, and I'll credit you, Mr. Andrews, with the second, if you're both okay with that. Either way, that's what I'm going to do. Any discussion on the motion?
Nope.
Okay, hearing none, I'll try to take everybody's vote. Maybe we'll go backwards. I vote yes. Mr. Harrison,
Yes.
Mr. Andrews,
Yes.
Mr. Newmark,
Yes.
Ms. McKnight,
Yes.
Ms. Thurston,
Yes.
Mr. Varela.
Yes.
I don't think I forgot anybody. My view keeps changing on me, which is why it's sometimes hard for me to figure this out. Great. It's unanimous. Thank you very much. Thank you, Anthony.
Thank you so much. Have a great night, everybody.
Thank
Stay
you,
safe. and
Beatrice.
Thank you. Have a good night.
Thank you.
Okie dokie.
Can I
Next up,
hang up, right?
next up on the agenda tonight is 229 Livingston Street, Jennifer Bistro. We have somebody here from that place? (229) Livingston, Jennifer Bistro. Going once, going twice.
I don't see that application in the Google Drive.
Okay. Maybe that got moved. I think I'm going off of an agenda that
hello.
may be dated.
Hello, उसको on करो ना.
Yeah, is it good?
Hello.
Oh, hello, Mr. Shahzad. Do you have
Yeah.
access to your application, or are you able to present it?
Yes, please.
Okay.
My name is Shahzad. Jennifer Bistro, 229 Livingston Street, and we are applying for a full liquor license. The place is located in the commercial area. The building is commercial. There is no residential upstairs. And our hour of operations are from 12 p.m. to 10 p.m., except Sundays, which will be from 2 p.m. to till 10 p.m.
Okay. Questions from members of the committee?
Yes, Mr.
Harrison.
What are the cross streets?
The corner is the corner of Elm Place and Livingston Street.
So it's on Anwar. It's on the north side of Livingston. Yes.
Yes, it's the north side of Livingston. Yes.
I know exactly where this is. Thank you, Mr. Chair.
What kind of establishment will this be? This is a restaurant, or can you tell us anything about it?
It's going to be finger foods and liquor and the background music.
Okay, Mr. Chair, can I ask a question, Mr. Chair?
Go ahead, Mr. Andrews.
What about accessible bathrooms? What about that, sir?
Yes, we have the male and female bathrooms, and we have their handicap accessible, and we do have an elevator for them too as well.
Okay. Got it.
What? Anwar, it's an elevator. Didn't you say first floor?
It is the first floor, but it's like there are couple of steps down. So for that, we made it to accommodate the handicap.
Yep.
Okay. Any other questions from the committee?
When do you anticipate opening?
It will take us 3 to 4 months because we are waiting for all this COVID and everything. We're just taking our time.
Okay.
Any questions from members of the public on this application?
I have a question, Brandon.
Oh, sorry, I have trouble scrolling. I didn't see you. Go ahead.
Okay. Did I miss something? We're just not seeing this application, or am I remiss in I haven't seen this application, right? Or I'm missing it. I didn't see it in the Google Drive, and I didn't come up on the screen.
It's definitely on the agenda, and I think it was just, I think it was just presented. I also didn't see it in what was just emailed over. Did we get email copies of this, Ms. Church?
Unless I missed it, no, I did not.
Okay.
So, I mean, it was a good description. It's just hard because I'm so used to seeing the actual questions and answers.
Oh, we need the
One more time?
Oh, we'll need to have the packet. I need the packet.
Right. Does the board office have one?
No.
No, okay.
Oh.
So, okay, number one. Number two, although I believe number one might lead to a little bit more discussion. Number two, Mr. Shazad, how many people do you expect to employ?
As for the customers?
Yeah, employees, total employees. How many will you have?
About 10. About 10.
10. Okay.
I have a question. What is the size, the capacity? How many seats, tables?
About 55 to 60 people we are thinking of accommodating. Because of this COVID situation, we want to have the proper distance.
Okay. Mr. Shazad, are you able to email a copy of the application to our board office?
Definitely, I'll do that. I did send the email, but which was received, and we had the confirmation for that. But I'll do that again. I did send it like maybe about 7-8 days back.
Okay.
I apologize, but I not see it. I don't have it.
Mr. Shazad, do you have access to the application on your computer now? If you like, we could share your screen.
Okay, maybe I can ask my son in a moment. Can you do that? Maybe.
Yeah.
Maybe my son will help me. If you give me a minute or so, please.
Okay. I'm gonna ask you to.
Yeah.
I'm gonna suggest we move on and just cover the next item on the agenda, and we'll come back to you in a second while you figure that out. It looks like the next item on our agenda is 690 Fulton Street, Broccoli Bar. Do we have anybody here from that location? .690 Fulton Street, Broccoli Bar. Going once, going twice. Okay. 90 Furman Street, Meadow. Oh, no, that's a renewal. That's a renewal. So I think we just need to complete this presentation here of this application. And then we can take a vote.
So just to clarify, 224 Green and 275 Park were laid over?
Correct.
Okay.
Yes.
If we don't have this application, Mr. Smith or Ms. Church, what do you recommend that we do?
He can just send it on. Just what he says about the opening hours needs to match what's in the thing.
Mr. Chair?
Let's see, Mr. Harrison.
Yeah, while we're waiting for Anwar's son to enable the site of the application, can we ask a question of Anwar?
Sure.
Okay, thanks. So Anwar, you said that it was about 50 persons who you would be accommodating there, right?
Yes,
50,
sir.
Right. And I heard you say finger food and drinks.
Yes.
Right. So while we're waiting to see the application, and I'm sorry if it was sent and I didn't review it, but it sounds like maybe others didn't see it. Is this then? So I'm trying to get an idea in my mind how this works. Is it kind of a stand-up situation where people are sort of schmoozing and there's kind of an area, not a buffet, but maybe sort of approaching that, where they would go get the finger food and they'd get their drink from a bar and there'd be seats, but they're sort of, or is it more formal sit-down kind of a thing, or?
No, I was just trying to say that it's not going to be a full cooking restaurant, you know. We won't be serving food, like hot food, preparing the food and then serving it, you know. So finger food comes in lots of varieties, you know. It's
right.
It's not something that, you know, we are going to, like, we have a buffet system or stuff like that.
Right. So it's a sit-down situation then.
Yes, sir. Yes, sir.
Okay. Thank you.
Okay. Mr. Shahzad, I want to kind of expedite this, and maybe we don't need to have the presentation if we can just figure out a few critical details. Can you just remind us again what are going to be the hours, and confirm if there are going to be any outdoor and indoor, or confirm if there's going to be any outdoor dining?
No outdoor. The hours of operation are from 12 p.m. till 10 p.m. Monday through Saturday, and Sunday it will be short hours from 2 p.m. till 10 p.m.
Yeah, right.
There be any music played?
Background music only.
Background music only? Okay.
Yes,
Can you just ask like if they could see the screen?
If you can see the screen, maybe we can.
I don't know if are you guys be able to like see this right now?
Yes.
Yes. Yeah, we can see that. Yeah, if you want to keep flipping through that would be fine.
All right.
Okay. All right.
Hey, keep going.
Keep going.
Okay, stop there for a second. Everybody can see the hours.
Yes, they're inconsistent though. These hours here say 12 p.m. to 11 p.m. Friday and Saturday, and then Sunday 2 p.m. to 11 p.m. Could you please clarify which is correct and either amend the application to match what you said or restate what you said?
Okay. Sunday we open from 2 p.m. till 10 p.m.
Sure, but it looks like that your application says 11 p.m. unless I'm just misreading your handwriting.
No,
no,
you're Jessica, you're right that it's not consistent, but
yeah.
But 2 p.m. it says 2 p.m. to 10 p.m. on Sunday.
Okay, that looked like
it's just 2 to 11 p.m. on Friday, Saturday, as you indicated.
So you had previously said 10 p.m. on Friday and Saturday. So can you just be clear about what are your hours for Friday and Saturday, please?
Friday is from 12 p.m. till 11 p.m. and Saturday is going to be 12 p.m. till 11 p.m.
Okay. Okay. You can keep going if you can. Thank you. Okay, stop for a second. So it says that you managed a similar business. What was the other business that you managed? And were there any complaints or concerns expressed about noise at the prior business that you operated?
I have the multiple experience. I used to manage sit in restaurants, the fast food places, miscellaneous experience. You can say like burgers, breakfast, American breakfast, hot dog place.
Okay, so how many other businesses have you owned or managed previously?
About maybe 4 or 5.
Okay.
In the course of like 20 to 30 years, we're talking about.
Have you had any issues with community members expressing concern about noise or any other issues related to your businesses?
Never.
Okay.
Brandon?
Harrison?
Yeah. Amar,
Yes, sir.
On your application, it says, I'm seeing Delight 7 Incorporated 472 Fulton. Is that the hot dog place that was on Fulton between?
Yes, sir. Yes, sir. It was.
Okay, thank you.
Yes, sir.
Okay.
Can you keep scrolling? Okay. Okay.
All right.
Okay.
Keep going. Great. Thank you very much. Any other questions from members of the committee?
No, Mr. Chair.
Any questions from members of the public? Hearing none. Does anyone wish to make a motion?
I do, Mr. Chair. Wholeheartedly endorse approval.
Is there a second? Anyone want to second this motion?
Second.
Second, Ms. McKnight. Motion, Mr. Harrison. Second, Ms. Knight. Discussion on the motion? All right. Hearing none. We'll do the vote. Mr. Varela?
Yes.
Mr. Newmark?
Yes.
Ms. Thurston?
I'll abstain.
Mr. Harrison? We'll come back to Mr. Harrison. Ms. McKnight?
Yes.
Mr. Andrews? Victor? I vote in favor. I think if you put Mr. Harrison and Mr. Andrews down for an abstention, then motion still carries.
We have 403.
Yep. Okay.
Wait, 1, 2, 3.
Just for clarification, Mr. Harrison made the motion, so there wouldn't be an assumption that he would approve? No, he has to actually vote it. Okay.
Yeah.
All right. Moving on along. Next on our agenda is the renewals for this go round. We got 90 Furman Street, Meadow Rue, 37 Washington Avenue, Il Porto, 60 Water Street, Oddfellows, and 925 Fulton, Hanson Dry. Ms. Church, any concerns expressed by members of the community with these locations?
There have been no concerns.
Anybody on the committee have any concerns about these locations? Nope. Any members of the public have any concerns about these renewals? Okay, hearing none. I'll entertain a motion with regard to the renewals.
Second.
All right, I got a motion. I'm going to call that a motion from Mr. Andrews. Do
I'll
we have a
second.
second?
I'll second.
Oh, seconded by Mr. Newmark. Okay, great. Any discussion on this? Hearing none. Mr. Varela,
Yes.
Mr. Newmark,
Yes.
Ms. Thurston,
Yes.
Ms. McKnight,
Yes.
Mr. Andrews.
Yes.
Okay, and I also vote yes. I think Mr. Harrison has departed, so we can put him down for having left the meeting at this point. Okay. Next up on the agenda after renewals, chairperson's report. In light of our extremely long meeting last month, I'm going to waive my chairperson's report tonight. I'll make it up next month. I want to get everybody out the door somewhat early, but respect everybody's right to their portion of this. other business? Any other business to raise?
I wanted to bring up quickly that last meeting, all that business with the Dazzler. Is it the Dazzler, the hotel with the issues of the sound?
It was formerly called the Dazzler. Now it's called the Tillery. Yeah. The
Tillery, right? We sort of alluded, or I might have alluded to the fact that this should. I would like to see it formalized, what we learned from that process, not just for our own meeting's sake, but also as a formal suggestion to the what's the committee? The land use, who sees designs in earlier stages and can pass along this sort of information specifically around, and people jump in to correct me, around where outside terraces and entertainment areas are relative. I'm sure it's not as simple as
you're talking about transportation, right? Because transportation does the sidewalk cafes, or because I don't think land use and also I think it's important to recognize with this location, it was within the property line, so it wouldn't have been a sidewalk cafe and it wouldn't have gone to transportation. I think that this is the only committee that they hit. So yeah, and I wouldn't want to do it, Brandon, as a requirement, merely just as like maybe I don't know, like a sort of a good neighborly policy. The sort of the larger buildings, and I don't know if that hotel qualified as one. I don't remember when it was being built, if any of its plans came through land use. But if it does, if that sort of suggestion could be made in the early stages, the designers, one of the architects who was from the community, and maybe someone else had said, this could have just as easily been on the other side, not facing a residential area, and it would have been just as effective. Easier said than done. But that's what I mean by maybe we can pass along this information and see if land use would be receptive to it. No, that definitely is an idea. We can touch base with Mr. Gordon and see that I'll touch base with Mr. Gordon between this meeting and the next meeting and see the degree to which he thinks there might be some overlap in these kind of circumstances. And like any comment you make, Alejandro, really any comment anyone on the committee makes, I'll make sure that we follow up with this to try to get to a point of learning. I mean, I think about that, and I don't want to bemoan the issue too much, but I think that there are a lot of things we can think about from this experience, which is be cognizant with hotels. Hotels change management. That there's a risk with hotels. Be cognizant with be aware when any applicant comes in, because just as they told us when they came in the original application that they didn't have any exposure to neighbors or anyone near us, it's on us to make sure that we keep track of where properties are located and call folks out when they raise things, although we don't expect people to misrepresent things to us, so that's part of it too. But there's definitely a number of things to learn from that process.
Along those lines, Brandon, I've often wondered. I'm remiss. We used to have a committee member who did this, who would go and visit the locations, although he knew the district like the back of his hand, Mr. Lasavecki. But I've often wondered if we shouldn't just check in and break up the agenda and be like, okay, who lives near this one, who has seen it? Because even areas that I'm not, even if I can picture the corner and I can see it on a map, I can't always speak to what the surrounding neighborhood is like and how, and so maybe we should do a bit more to inform ourselves when we're not super familiar with the space.
Maybe that's something that I don't want to create a rule for what our committee can do, but I think maybe that's something we can talk about and we can think about when we get hotels that come before us, particularly.
Perhaps there's also just a way that we elevate hotels specifically and ask them to come before either us or the executive committee. I only say that because Caroline can speak to this much better, but I don't actually know that this would have gone to land use in any sort of detailed way. So maybe there's a way that we could talk to Lenny or just discuss this at our next executive committee meeting and just say, how can we put the word out that if there's a hotel, we, really strongly encourage them to come at least before the executive committee, and ideally to us and to land use or wherever we think is appropriate, so that we're at least part of that conversation, even if not in a formal way.
Mr. Chair, Mr. Harrison did vote, but he got cut off. I don't know if you saw that, Mr.
No, I see the comment. We can put Mr. Harrison down for a yes for the item where he moved to approve it. I believe his comment is sufficient to indicate his intent. Did anybody else have any other comments from the committee on Mr. Varela's thoughts, as well as the lessons learned from the?
I mean, I guess, Mr. Chair, we have to stay on top of people when they say management. I guess, and I thought Tanya was the one who was going around to visit Moses. That's what she told me when I saw her. I think it was sometime last week. She said she goes around to most of the restaurants and visits them and stuff like that.
That's great. It's great that people do that, and there's also Google Maps, so you can look it up over there too. I think unless anybody has any other comments on this, I'll take that question up regarding the land use. I'll think about that more on the executive committee. I kind of feel like, there's an expectation that work is done at the committee level and that we're fundamentally more responsible for that. But I'd be open to having any further conversation about that, and I'm definitely going to think about it more too.
So if I may, I think it has to be more of a conversation about what the committee would like, because this hotel might have been as of right. So the community board would have had absolutely no contact with them until they came with their liquor license. So it requires a lot of thought about what we'd like to have and how can we get it.
Right.
Because if it's not a ULURP application or a BSA, they're not asking anything of us.
Right.
So
that's true. That's true.
We'd have to create a process.
Right. Okay.
And if I may just drop one quick comment on this, is that the complaints have continued from the neighborhood. So
Meaning since our last meeting?
Yeah, the events have continued. So,
but Carolyn, to be fair, guys, she did say that she had a bunch of events already booked, and my main concern is if she already paid these people and they cancel, whoever the entertainment is, you're not going to get your money back, so they're stuck in the catch-22 on that.
That's true. They're stuck in that, but they booked those events. Let's go back the truck up a little bit more. They booked those events after having already agreed not to hold the noisy events outside. So they kind of dug that for themselves.
And just to not relitigate that conversation, Carol Ann, have you heard complaints after the 26th, which is when I think they said was the last day that they would hold events?
That's a good point.
So that would have been in the last week. No, there were no complaints last week.
Okay. Not to, the other complaints are completely valid, but we did probably expect that through the 26th.
All right. Any other comments on this issue with the Tillery? This is not the end of this conversation. I think, obviously we're going to need to stay on top of it. Okay, moving right along. Next up on our agenda is community forum. Does anyone from the public who's attended the meeting and still remains here in our virtual room would want to speak?
Hello.
Mr. Beasley.
Speak? Huh?
Mr. Beasley, did you want to speak?
I did. Hello.
Okay. Just before you speak, I just want to let you know we try to ask folks to keep their comments within about 2 minutes. So please try to do that. Thank you.
Absolutely. Well, hello, public service warriors of Community Board 2. I'm Stephen Anthony Beasley. I'm the community for New York Presbyterian, Brooklyn Methodist Hospital, but really across the city, which we're made up of 10 hospital campuses, about 3.4 million visitors a year. I don't know why my camera just turned off. We here in Brooklyn specifically, though, we have 6,500 residents or more who are employed by us. Our inpatient discharges from NYP in Brooklyn is about 36,000. And in my 300 community events that are that happen in person and virtually, even before COVID-19, that reach about 10,000 folks. We are just here tonight to just do a quick update, just to remind you all that we're here not only at the corner of 7th Avenue and 6th Street at our main hospital location, but also in about 36 medical group offices with dozens and dozens of specialties and clinicians who are just excited and waiting to help you. The nearest one to CB2 would probably be our location right behind Barclays at 38 6th Avenue. I believe it's 38, forgive me if it's not. And in February of 2021, we're going to be offering a number of services in cardiology, orthopedics, gastroenterology, cancer services, radiology services, and women's health in a 400 square feet Center for Community Health that will be opening on the corner of, it will take up most of the block of Street between 7th and 8th Avenues. Just a little bit more we do about 30% of all our patients have Medicaid, 35% have Medicare. Also is available if you should find yourself in a situation to the hospital or have hospital services that either you're uninsured or even your insurance with the copay can't afford, you can apply for our financial aid. And that's for individuals and families that earn up to 600% of the federal poverty line. I am so sorry about this video situation. So in case you maybe have an existing bill or anything like that, the number is 866-252-0101. And I'll leave that as well as a link in our chat. And for 2 of our upcoming virtual events, I'll leave links. There's one on neck pain, which I'm actually preparing for tomorrow morning. I'll leave the registration link. And that's in partnership with Good Neighbors of Park Slope and Heights and Hills. But you don't have to be a senior to come to that. And then our very next lecture after that is going to be on diabetes education and awareness as part of a few months of virtual programming that we've done with the Brooklyn Public Library. So again, nyp.org/Brooklyn for all of your needs. And, we're here to serve you and to do our best to make amazing things happen for New Yorkers when they need care at NYP. So that's really it. Hope I've made my 2 minutes, and I'll leave those registration links in the chat. Okay.
Thank you very much, Steph, and we're really grateful for you to come and speak to us. And I would love to hear more about your organization and the work at the hospital in the future. I think it'd be great to have you at another meeting at some point, and maybe get you a little bit earlier on in the agenda.
Yeah, no problem. I understand what happened with tonight, and I wouldn't be interested in coming back next month because we have some discussions that we're going to do around racial equity in association with some local electeds. And so when we get those dates finalized, I would love to share when that information is and when that event is and other updates.
Okay. Would you be able to share any contact info for yourself with the board office or anyone?
100%.
Great. Thank you.
All righty.
Thank you very much. Any other members of the public have any comments for Community Forum?
Hi, anything for me to do as for my application is concerned?
Mr. Shahzad, I think you can speak to the board office. Ms. Church, I didn't want to cut you off, but feel free to go ahead and explain to Mr. Shahzad.
Oh, yes, Mr. Shahzad. Can you please resend the email?
Sure, I'll do that.
Thank you.
Great, thanks. Now, I don't know why this was the case, but it seems our approval of the minutes has fallen down towards item 9 on the agenda. I'm going to have to ask for a motion on the minutes from October of 2020.
Second.
All right, I've got Mr. Victor. Again, I'm going to call that a motion. Do we have a second?
My bad.
It's
I'll
not your
second
bad. It's not your bad. Who was that who seconded? Was that
Nicole McKnight.
Oh, thank you, Ms. McKnight. All right,
You're
great. Any corrections or concerns about the minutes from last month? Not seeing any. Could you just briefly give a show of hands so we can get an idea of? I got Ms. McKnight. Who's in favor of this motion? Ms. McKnight, Ms. Thurston. I'm in favor. Mr. Andrews, are you in favor?
Yes, favor.
Okay, Mr. Newmark. I got Mr. Varela. Oh, Mr. Newmark's going to abstain. That's fine. And did I miss it? Well, Mr. Harrison is gone, so we're going to count him as not here to vote. Okay, minutes from last month are approved. At this time, I will entertain a motion to adjourn.
I make the motion.
Barry makes the motion. Any seconds?
Second.
Second by Mr. Second by Mr. Andrews. Okay. Any discussion? And
well, just that job tally report, 64 potential jobs out of today. So low on the lower end, but 64 jobs.
Noted, and thanks for letting us know, Andrew. Okay, everybody in favor?
Aye.
Aye, everybody's in favor. Okay, have a great next month, and great meeting, everybody. Thanks for making it work with the abbreviated time. Bye-bye.
Thank you, Brandon and Jessica.
Bye-bye.
Thank you, Meadow. Thank you, Caroline.
Stay safe.
Bye, everyone.